Hi, doctor. How are you?
I'm good. I'm good. How are you?
I am very well and excited for this session. I'm going to welcome everybody who has joined us. Thank you guys so much for joining in. Today, we're talking about body contouring, and with me is Dr. Jayanthy Ravindran from Tamira. So, Dr. Jayanthy, welcome. Thank you so much for joining us today. And let's get right into it because we don't have a lot of time. This is a topic where I'm sure a lot of people have loads of questions.
Sure.
Maybe we should start off with what is body contouring? And everybody, of course, wants to stubborn fat, right? So they're super excited about the concept. They're like, I have these bits of stubborn fat. I want to lose it. How do I do that? So you're the one to tell us all about body.
Yeah. So basically, everyone aspires to have a perfect body or ideal proportion. So the aim of any of these procedures is to somewhere get close to that. I think that's what everybody aims at, right? We all idealize some proportion, some body figure, body image, and we think when we look at some artist, somebody in the media, we think, oh, that particular figure is very nice. They have nice hips, nice buttocks, and some people aspire to because that looks aesthetically pleasing for their eyes, and they aspire to want such proportions, but not all the time, or those proportions might suit everybody's body image. So basically, there are proportions which match, shoulders, waist, buttocks, and things like that. So trying to get to near that ideal proportion is what we call body contouring. So sometimes when the lifestyle is not appropriate, people do accumulate fat. I would say mainly the reason is lifestyle is the most important reason, but genetic predisposition, and of course somebody having met with some accidents, so not being immobilized, and so certain areas there is accumulation of more fat compared to the other areas. Sometimes there's a lot of genetic components. So you will see some people having only a big buttocks. Some people will have predominantly more fat on the chest. So it varies based on genetic predisposition as well. And trying to get correct these to match the perfect proportion is what we call body contouring. Many people think coming from 140 kilos to 90 kilos is body contouring. That is not body contouring. That is weight loss management. So people should not confuse between weight loss management and body contouring.
And would I be saying, for example, if you go to the gym, and most of my friends who are gym trainers say that people come and say, I want to lose weight here. I want to lose weight here. And a gym instructor will tell you there's no such thing as spot reduction. Not possible. You will lose weight on the whole, and again, how everybody's bodies react to weight loss.
Perfect. So that's
the next step be body contouring. Then would they come to you then?
Perfect. That's exactly what is body contouring. So when you train to lose weight, you basically try and lose when you're working out or when you diet, you are likely to lose weight proportionately.
Yeah.
But when you put on weight, because of this, I mentioned those factors, you might not put on weight proportionately. You might put on only in your waist. You might put on only in your arms. That is a genetic predisposition. So when you have a genetic predisposition, obviously to get rid of those stubborn areas, definitely only you need the help of an aesthetic surgeon or a physician, depending on the choice of procedures that you're seeking for.
Okay, so the other big a lot of people, I'm sure, know is how, for example, if someone wanted to get it done, how much time would they have to set aside from their regular jobs to do something like this? What is the downtime on something like that?
So it will all depend on the choice of procedure, Paloma. So if you look in the media, you have so many procedures. See, there isn't a single person who doesn't want a perfect body. Any men, women, everybody wants a perfect body. So everybody desires, when you're, let's say you're reading some article and suddenly you see some thing saying that in 2 days you can get into perfect body shape. You're curious to know what it is, right? Even as a surgeon, if something is there, I will not know, have I missed something? What is this they're talking about? In 2 days, I can get rid of this. So that curiosity is there for everyone. But what is reality, right? So what are the options available? So you have loads of non-surgical options. You will see, so many ads. So people think lose 9 kilos in 4 weeks. These are all ads I see. Lose 10 kilos package of this one. And then it medically, if you look at it, you will have procedures, you'll have options, surgical and non-surgical options. When you have a surgical options, you must think that definitely the surgical option is going to give a far better result than a non-surgical option. Because if the non-surgical option is going to give the same surgical result, why would somebody do a surgery, or why would somebody actually want to get a surgery done? Right? Why would a surgeon do? Because obviously you're going to pay the physician to get that particular result. You are not if it is non-surgically it can be offered. I don't think any surgeon would take that risk of going through a surgery, waiting for the result and all that, right? So non-surgical is simple. So the surgery and non-surgical have their limitations, right? Generally, if you look at it, non-surgical will look at more invasive, more downtime, and so, but the results will be far better.
Okay.
Right? And more long-lasting. Non-surgical, usually less downtime. Many of them walk in, walk out. But cost-wise, non-surgical can be more expensive because they are based on devices. So some of these devices, which are very safety backed up and which consistently give good results, are all very expensive because they are imported and they come with cards and so on and so forth. So unlike, that's exactly the thing. Many people think that non-surgical is cheaper compared to surgery. That's wrong. Right? I'll tell you an example. Let's say somebody is looking at contouring the abdomen, right? So, let's look at two options. Let's look at the option of cool sculpting versus liposuction, right? So liposuction is surgery, cool sculpting is non-surgical. Now, for someone to remove the excess fat in the abdomen and flanks, you might need to freeze and lyse the fat in the upper abdomen, that is above your navel, below your navel, and both your flanks. So cool sculpting works in terms of cycles. So you can cover only one area in one cycle. So let's say you need 4 cycles, both above, lower, and both sides. 4 cycles will approximately cost you around ₹1,00,000 for one session. But that doesn't mean that once you finish this 4 cycle, you'll get a perfect hourglass tummy. You won't get. After 2 months, you might want to repeat it again. So when you want to repeat it again, it's another ₹1,00,000. Again, some people might need a third session. So totally, you're going to put ₹3,00,000. Let's say if you do 3 sessions, even after putting the ₹3,00,000, your shape is not going, the result is not anywhere close to the surgical result.
Right.
Whereas the same 75 kilos per person, if they do a liposuction for body contouring, the cost would be somewhere around 125 to 1.5 lakhs or so. And you're going to get almost 80 to 90% of your fat removed.
Right.
But in liposuction, it is a surgical procedure. So there is a downtime. You're going to go through a little more pain and discomfort, which are controlled with medication. But there is a balance between both. So you have to ask yourself, what do I want? Do I want to go every now and then do procedures while I'm working, I'm diet, I will do my diet and exercise, and slowly I'll get there. Then yes, non-surgical is option. But I have this image, okay, in 4 weeks, I want to get my perfect shape and I want to do. And then but I don't want surgery, but I want cool sculpting, but I'm expecting that result. That's when we have a lot of clients who are dissatisfied.
Right. And like you said, everybody has sort of an idea of what is perfect and how a perfect body should look. So do you have to show you a celebrity's picture and say, these are the abs I want? Or
absolutely, that's another big issue that we face, Paloma, because people come to my clinic and say, okay, you know who's trolling in the media, right? So today, if there's somebody comes and tells me, oh, she's lost so much of weight, what has she done? right? I will answer is I have not done anything. That's all I can tell, right? What else can I say? Otherwise, they'll say, oh, somebody was like this and now they are like this. What did they do? Right? And everybody, they forget to understand maybe that particular person they are referring to might have sought some help of a physician or a surgeon. But in addition to this, they might have also worked for it, right? They must have gone through a vigorous diet and exercise plans and everything, right? So it isn't that, and they might have had not have had too much of loose skin. Their skin quality could have been better. Their lifestyle is different, so they were able to achieve that result. Doesn't mean that everybody will achieve that result, right? Someone very lean person will have just a flabby abdomen because they've gone through 2 3 childbirth, right? So it's just loose skin like a dough that they have in the tummy, and then they want a perfect ironed out tummy, right? And that is not the same as, you know, doing somebody who's got a tum, and they could still, when they wear a tight dress, they may not have a perfect hourglass, so they want to get there. But that's more to do with skin excess. Then when they aspire to have a body contouring, it's more of tightening the skin, removing the excess skin. So again, the procedure is different, right? So it's not that you do one procedure and you can handle everything. So when in any area, right, you have different what do I say, you have fat excess, you have skin excess, you have both, and depending on the proportions, what are the non-surgical options that need to do. Even surgical techniques will vary.
Right. So, Doctor, we just have a question coming in. Rashmi, body contour similar to aspects of plastic surgery?
Yeah, I also, sir, let me read that question again. Is body contouring very similar to aspects of... Yes, body contouring is plastic surgery, but the options of getting there, you have many number of procedures. It can be skin tightening options. It can be fat lysing options. It can be a surgical option. So you have so many. For example, let me give you some example. Skin tightening. You have the commonly used energy or machine that uses the energy is a radio frequency, okay, right, for tightening. Now, just like any other industry, you have hundreds of brands which utilize this technology in different way to deliver the result, right? It can be used in theater, it can be used just in the outpatient, and each one will vary with the result.
And I think you gave a good example, someone who is slim, maybe who has had a baby, who has, you know, the loose skin around the stomach, or other friends.
Correct. So now one of the best platform today launched is called, it's from a company called InMold, and the platform is called Embrace. It has got 2 hand pieces. One is called the Embrace RF and one is called the Morpheus 8. I'm just mentioning these names. You can just Google YouTube, because these are all the latest technology. But that they are not equivalent to a surgical options where we call them a tummy tuck, right? So someone who has before and after image of tummy tuck, then sees an ad for Embrace RF, where also they put a similar tummy tuck, but could be because of marketing. And then they think that they are going to deliver the same result of tummy tuck. So they've been reading about tummy tuck, now decide to come and do Embrace RF, but think that they're going to get a tummy tuck result. It's not the truth.
Right.
Every procedure has its advantages or limitations, and in terms of results, downtime, cost, everything. So it's important that the client understands first what is their requirement. Let's say somebody is like you, who's, you know, maintaining a good lifestyle, good body proposition, but you know, you have some area which is very stubborn and you want to get rid of it. Right. Obviously, then it comes how soon you want to get rid of it. Correct. And then based on that, the surgeon or the physician is going to offer you the options, right? So if there isn't a non-surgical options where you'll come to the clinic in 10 days from now. Let's say somebody comes today and says, in 10 days from now, I have a shoot and I have to be like this. Obviously, no machine can help you to get there in 10 days. Correct. You might have to suck off a little fat from there if you want to get that. That's a liposuction. And you can do it more precisely when you use additional energy during liposuction, like when you use an ultrasound or a laser, which are more advanced thing, but to get the perfect result.
Right.
So there's a lot of things that's involved in a body contouring. Everybody thinks it's like, they see one ad and they think, okay, everybody should understand all these are advertisements, right? So advertisement is advertisement. They will say, okay, you get abdomen, and it doesn't mean that the results. So when you go to an expert and speak to them, they will help you to understand the plus and minuses of each of these process. And then you have to put forth what exactly you aspire, what is the timeline you have, and what are the risks you're willing to take. Not risk in sense major. Like, for example, I have somebody who comes and says, I want to do it, but I don't want to tell anybody. Right?
Correct.
Nobody coming. So then you just have to come into the clinic and do a non-surgical procedure, but you have to repeat multiple times. So all these are options, right?
And also, I mean, you just touched upon this. Somebody say, for example, not wanting anybody to know. That's part of what you all do. If you don't want people to know, then you all keep things.
Absolutely. Yeah.
So that is an option as well.
Yeah, absolutely. So, but see, when you're doing a surgery, there is something called when someone undergoes a surgery, and they are opting to surgery. Some surgeries are done under general anesthesia. So there is always a column where, according to medical, ethical norms, you have a consent to be signed, and that consent has to be signed by the client as well as a witness. So then obviously when you want a witness signed, we want somebody to come with the patient and to say that if there is any emergency, we will inform them. This is a general norm across the globe.
Right.
Right? But whereas it's a non-surgical procedure, we don't need to get such witnesses signed, and then we don't have to disclose it. Obviously, when you take a witness signed, that means the client is accepting that this can be disclosed to that patient, and that's why the witness is taken.
Right. And with regards to a couple of myths, for example, you said a surgical procedure is not necessarily more expensive than, say, the non-surgical route. That's something interesting we learned, because the assumption is, can I afford surgery? Because people say that, where do I have budget, to do a surgery?
Absolutely. So
what are the other myths? Let's do a little myth busting.
Okay. So the other myths is, we'll start with most important, surgical and non-surgical giving the same result, right? That is why the advertisements with non-surgical are so attractive, almost promising a client that it is equivalent to surgery, and so they have to understand that. It's a lot of things. When you see an advertisement, please look into whether that same physician or the same surgeon is offering the non-surgical as well. If a surgeon is offering both surgical and non-surgical, there is no need for the surgeon to push one procedure over the other.
Yeah.
But if the person is not offering a surgical option, obviously they're going to push the non-surgical option onto you, because that's what they are offering, right? When you go and buy something from a store, they will try to sell what they have. That's the truth, right? So keep that in mind. So that is the first myth, is to think that the non-surgical can give you the same result as surgical. That is the first myth. Second, you are scared because when you hear the word surgery, you think it's more dangerous compared to a non-surgery, right? So it isn't like that. Not always. If all the procedures, unless they are consistently giving safe results, it will not be medically approved. Of course, when it is done by someone who's not trained to execute the procedure, you might end up in complication. But that can also happen with non-surgical. So I have seen patients who have undergone the so-called cool sculpting with a machine which is not the patented technology from the patented company, a look-alike machine, and then they come with frostbite. That is because the skin is cooled, and then they get when you extreme cold, when it's applied, right, you can get blisters even in cold. So they have come with frostbite, right? So yeah, so it's simply because
I've seen burnt skin for something as simple as laser hair removal. They've come with burnt.
Absolutely. So all this can happen. So lots to do with the machine that is used, lots to do with the settings in the machine. So it's not like somebody has the machine, everything goes well. right? Whether it's a surgical or non-surgical, you'll have to understand what are the after effects or a complication that can happen with the procedure. And then you have to take a calculated risk. Risk is not much. It can be very minimal, but you have to have faith in that physician and then go ahead with the procedure. So because when someone wants an so-called result, and when the surgeon clearly explained to you that surgery is the option for you, and you decide, and my friend told me, so I'll tell you an example. So a few days back, I did a surgery for a patient, and she came in and she basically wanted to tighten the neck. So I have examined her and I asked her, so I always ask the patient, what is her expectation, right? Options are given only based on patient's expectation. How much of tightening they want, what is the contouring that they expect. And then I want something that is permanent, all this. So you explained. Oh, patient listens to everything. You say this will be the cost, goes back, comes back after some days and says, my friend told me that I should not do this procedure.
There's always the friend, no?
Yeah, the friend. So the friend said that is not right for me. But I said, okay, so we will eliminate that procedure, but the result will your friend take responsibility?
Correct.
How can she decide the procedure and I take responsibility?
Right.
Right? If I tell you an option, then I take the responsibility. If your friend tells the procedure, then the friend only should take the responsibility, right? And there are many times clients who come and say, even for small things like you need, let's say you want to put filler, and you say, I want 2 fillers, and somebody says, I want only 1 filler. Okay, fine, I'll put only 1 filler. But then you have to decide, no, you are the one who decided you want 1 filler.
Yeah.
Yeah, that is fine. That is fine. If you think this is what, you take it, but you take the responsibility of giving, because taking the responsibility of what the outcome is going to be. But when the surgeon says, based on their experience, they feel that this is thing, instead of suggesting what the friend says, you can ask. You can always ask the surgeon, see, my friend was against doing liposuction in the neck. What is your take on that? Why is that you prefer to do liposuction? And then you evaluate and take a decision is fine. But you can't just...
Somebody has something that's gone wrong, then they're bound to remember, see, my friend tried this and it went badly. So, you know, what happened to me, doctor? I'm sure you get that as well, right? Because I've seen a lot of things have gone wrong. So, you know, that's also quite... So I'm sure you get that.
Absolutely. So that is a difficult part of, when we handle procedures. This is one of the very difficult, task for us to convince the client to accept whatever is the surgical plan or the non-surgical plan that we think is appropriate for the patient based on their requirements and the time that they're willing to give for this procedure. Many a time patients will say, okay, I want one time, I want permanent result. All that is accepted. But after surgery, that downtime of 3 weeks every day, oh, I did not know like this. I wanted the next day my results should be available. Should be visible. This much is there. So they don't have patience to wait for that 2-3 months for them to for the results to be obvious. So it's very important that see, in the West, in most places, everybody around you, either somebody, your friend, your neighbor, somebody gets these procedures. So everybody and is openly talking about it. Unfortunately, in our society, this doesn't happen and not everybody talks about it. So you have to go to the media to read about these procedures. But I'm okay with that. But you read, when you read, don't read what exactly only you want. Make sure how you get all the necessary information in terms of there are a lot of platforms right today available where patients give their feedback openly, maybe less from our country, but other country, you will have patients feedback who've gone through these procedures. So you read them, you understand what they have spoken about the results, and then take a decision. That would be the right thing, I would say.
Yeah. And we don't have too much time. I want to quickly ask most common procedures that are done in India, because like you said, so much is being done but not talked about it. People don't want to admit.
Okay, so I'll tell you the body contouring. Yeah, so the body contouring procedures, I'll start with the non-surgical procedure. So basically when you want to contour a body, you want to remove extra fat that is deposited, or you want to tone the skin that is loose, right? These are the most important, right, in body contouring. Now, to remove the excess extra fat, you can, you have technologies which will involve heat, we have technology which will involve freezing, right? Or using an ultrasound, or using a laser. These are energies. One of these to lyse the fat that is stored. So in my experience of evaluating all of these, only some platform consistently give good results, right? So I resort the cryolipolysis, or that is a technology where you freeze the fat to lyse the fat. And the company now, the Cool Sculpting is a brand, right? Cryolipolysis is a technology, and it comes from a company called Allergan today. So I basically, it consistently gives you good result. But yes, if you look, there was a recent article where there was a lot of talk about paradoxical hyperplasia, which means less than adequate energy in that area actually caused the fat cells to multiply instead of lysing. So these are all things they should know when you're doing non-surgical options, right? So, but cryolipolysis is a very patented technology to lyse the fat. But for the number of cycles that it's a walk-in, walk-out procedure, not much of a downtime. You'll have minimal discomfort, some pain. You can take some painkiller.
What body part are people doing?
So you can do any body part. For example, you can do your double chin. You can use your bra rolls. You can use your love handles. You can use your abdomen. You can use for your thighs. Any body part, because there are various probes available for them. But depending on the thickness of the fat that you're trying to reduce, the number of cycles will vary, right? So approximate cost for a cycle will be roughly around 20 to 25,000, and then will depend on number of cycles. You may need 4 cycles, 10 cycles, whatever it is, depending on the areas that you want to do. This is one part of it. You also have other technologies for this fat size cycle, which they use either they call radio frequency without invasive. Non-invasive is also used, but doesn't give much result. But in the face when you want to contour, because there's not too much fat, right? It's more the same. They use radio frequency, and that platform is called Thermage. Again, Thermage is a brand name. It uses the technology called radio frequency. So it is done from outside. So where the collagen elastin is induced and also fat is lysed. So if you want to contour your face, then you use what is called, so tightening, face tightening.
Pardon me? About the abs, but now it's all about the jawline.
Exactly, correct.
Correct.
So then you use this platform called Thermage, right? I've told you about the Cool Sculpting and Thermage. Now the radio frequency, the advancement has gone one level up, where you can put a probe into your skin, under your skin, and then lyse the fat and tighten. That is what I called you, is from a company called InMode, and the platform is called, it has 2 hand pieces. One, it's called Body Tight, and then it has 2 probe, Embrace RF and a Morpheus. But that also uses only radio frequency. So I've told you about cryolipolysis, I've told you about radio frequency, right? These are non-surgical. So Thermage or radio frequency is mainly used to tighten the skin, right? Fat lysis is mainly used to by cryolipolysis, but also ultrasound. Ultrasound externally is also used to lyse the fat, right? You would have heard of this technology called Altera, right? Where they use ultrasound to lyse the fat and tighten the skin. Now this is non-surgical, machine-based. But if you want to contour your face, smaller areas, there are other ways to contour without any of these machines or the surgery. So you can put injectables. You just inject something. You can just use threads to lift something and contour. So that is possible.
Threads everywhere.
Yes. So that is all just to contour smaller areas. Now, if that is available, people think you can do threads to lift your breast, a heavy breast. It cannot work, right? It doesn't give any results. So people they were looking at the advertisement, they think, okay, it's now threads, I can do threads anywhere in the body and lift everything. It's not possible. You can lift smaller tissues because those threads are put under your skin. What is the weight they can carry? So they have very limited results. But when done in specific areas, combined with others, they do help.
And the other question, Doc, is something that somebody sent me earlier on, which is, for example, if we undergo one of these treatments, again, it's a very broad question. How long does it last?
Yeah, so that again depends on the procedure. So last is, let's say you do threads. You're doing thread because some of your tissues have descended because your elastin and collagen has disintegrated, right? Or now you're trying to lift. These threads are, you have absorbable, you have non-absorbable. Absorbable threads, they absorb and form some tissues which actually helps hold the tissues in the lifted position. But the aging process is going to continue, right? So when the aging process continue, let's say today I saw a consultation where somebody lost 10 kilos in 6 weeks.
Wow.
Now, if you put threads and use 10 kilos in 6 weeks, at the end of 6 weeks, your face will sag again.
Okay.
Right? I just saw somebody who did that, crash diet. And so you have to understand all of these procedures have limitation.
Right.
Let's say you put a filler, you're contouring face or injectable, you're contouring the face with just injectables, fillers or Botox or botulinum toxin. And then you lose like this, right? 10 kilos in 6 weeks, 8 weeks, 3 months. Your results will go off, even though the company says or that physician told you that this result will last for 6 weeks or 6 months to 8 months or even 18 months. But that is under ideal conditions.
Correct.
Yeah. Which may not be the same for everyone.
Right.
So you might lose it in 3 weeks, 3 months itself because you've lost a lot of space and it's moved into the tissue space. Your body's metabolism was high, so it's metabolized the enzymes. A lot of other things can go into this. So this is a non-surgical option. So I've told you injectables, I've told you cool sculpting, I've told you thermage, and we have like the same. So we have so many of these. So all contouring is mainly, tightening is mainly with radio frequency. Lysing, the technology that I trust, is mainly cryo freezing the fat, right? These are two technologies. Now, when it comes to the similar surgical options, liposuction, that is, you suck the fat out. But while doing liposuction, we use ultrasound as an energy to lyse. So when you are just putting a tube and sucking, right, you have this big area of fat, you put a tube and you suck. So you'll be sucking here and there, right? And then it is still uniformly, it can be sucked, but the chance is that some tissues will be left behind. But when you put an energy and that energy goes and it melts the fat, right? The fat lysis is more uniform. Okay. That's when you get this high definition body contouring. They call it, high definition body contouring or 360-degree liposuction, where additional energy is used.
This is as opposed to older technology, is it?
As opposed to traditional liposuction. Now things are becoming more advanced. People use additional energy to lyse the fat and give you more contoured figure, right? So we use one of the device. The brand is called Vaser. Most of the time, people use that, and then they come and say, "Do you have this? Do you have patient come and ask for specific procedures?" So Vaser is an ultra device which uses ultrasound to lyse this fat. So you lyse the fat, then you suck the fat out through another equipment. Even with Vaser equipment also will provide something to suck. Then you use a different technology. But after we remove, we also have technologies where you can tighten the skin.
Okay, correct.
So you lyse the fat, you remove the fat, and then you tighten the fat. Tighten the skin. So you use radio frequency again internally to all the septa to shrink, and so it tightens. So the effect, mainly if you look at men who have big chest and because of enlargement. Similarly, women who have big tummy, after you remove the fat, if they do not want a tummy tuck, but the skin has to be tightened, then an invasive RF is a good option. but it's not equivalent to the result. It's like somebody who had multiple pregnancies, like twin pregnancies, two twin pregnancies or twin pregnancies, and the skin is very loose. RF cannot tighten all the skin. They can get some results, maybe 30%, 50%, but not 100%.
Yeah.
Right? So if it's 100%, the option is then you have to look at proper tummy tuck.
Right. And it's ideal for them to meet you and then you advise which route they take.
Yes. So all these are options: cool sculpting, thermage, Venus Viva. All what I'm mentioning are names of machines. They use ultrasound, radio frequency, cryolipolysis. All these are technologies that they use. But again, surgical, we have liposuction. Again, liposuction, like I mentioned, high definition liposuction or 4D liposuction. You'll have safe technique, tumors and these are all different techniques that different surgeons use to give you the final results. So basically, when you are choosing a surgeon, you have to know if the surgeon is trained and is performing these procedures on a regular basis. And then if they're constantly upgrading the technology, because there could be something new in the market. And then based on your downtime and what your expectation is, you will have to discuss with the surgeon and choose the procedure.
And be okay with your clients asking you lots of questions, because, for example, irrespective of what kind of doctor the person is, whether it was the OB who delivered my baby or any dermat I go to, I ask a lot of questions. So do you encourage?
Absolutely. I always tell my patients that they should take 2 or 3 consultations. I'm not at all concerned about that, simply because when they come to me, let's say I give them a surgical option, right? Unless another surgeon also gives the same surgical option, or same procedure options, how will they know that that is the right option?
Yeah.
Right? So I'm okay with them to take consultations with 2-3 people and then decide. Then whichever surgeon they have the confidence in, they can opt to go ahead with the procedure, because these are elective surgeries, and I think the client or the patient should be informed about all the possible the end result, or how is the recovery period going to be, and what is the result to be expected, and then they take a decision.
So for everybody tuning in, I mean, everyone's thought about different things in life. Like you said, some people come to you because of, a particular lifestyle. Some people it's age related. Some people it could be diet. It could be whatever, right? So for everybody tuning in, before we sign off, what would you tell them? What do they need to keep in mind about body contouring? As last.
Yeah. So what I would like to tell all our viewers here today with regards to somebody who's aspiring to consider doing any of this procedure is, first of all, they have to write down what they want as end result. So in my consultation, when someone comes to me for a consult, I ask them what is their if I treat them, what is their result that they're expecting. So that's how I start from. I start from the end. So if somebody comes and tells me, I am 130 kilos, that I want to get to 65 kilos, then we don't talk about body contouring. We'll straight away talk about weight loss management. Because what she told me, I want to come from 120 to 60. I have to look at weight loss, right?
Correct.
Now, if another client comes and tells me, my concern is the end result I want is an hourglass stomach. Right? So that is the end result. And then tell me, doctor, I want to do cool sculpting. My answer is, with cool sculpting, you won't get hourglass stomach. That's all. There is nothing in between here.
Okay.
If you want hourglass stomach, you have to do only tummy tuck.
Okay.
Many clients think, because they read they come across so many advertisements, so many things, little bit here and there, all this. They have to understand there's some truth in that, and not everything is the truth what they read.
Or I appreciate a person who will tell me the truth. I love it when someone says, no, that's not possible.
Because, everybody, it's not that everybody has to speak the truth, right? Some celebrity must have lost so much of weight, and they might be telling them that, I followed this, I followed that. And then the patient particularly comes and they believe and they don't believe. They think that we will give you an answer of, okay, something she has done, she's becoming like that. What can I do to become like that?
Correct.
Right? So please don't think everybody's body is different. You don't compare yourself with someone else, right? You write down what is the end result that you are seeking. And for that end result, you read about various options. You discuss with the surgeon about various options. And then you decide, okay, I am okay to accept 30% result. I will go ahead with this procedure.
Yeah.
I am okay. I want only 100% result. I want only permanent result. Then when the surgeon tells you that this was not going to give you permanent result, you just have to buy that and forget about that procedure.
Yeah.
Right? Otherwise, it becomes extremely difficult for the surgeon to, after doing the procedure, you said, no, I will try this. See, you're coming and asking me, I want a perfect stomach, and I'm telling you, you have a lot of excess skin, so you have to do only tummy tuck. Otherwise, no, doctor, I will try Thermage. I'm fine with that. Okay, fine, I have Thermage. I have told you, and you're saying you will try. Right? Okay, fine, you try. But then after some time, doctor, I've tried Thermage, I have not got any result. Now, what is the answer am I expected to give?
Right. Because you already advised them. Yeah.
Yeah, I told them that tummy tuck is the best procedure. You decided, no, I will try the non-surgical. You've told that you will try. I have told you that it's not going to result. You listen. Your mind did not listen to what I mean, then because they are fixed on, I want only non-surgical.
Correct.
Then if they tell me I wasted my money on a non-surgical procedure, how is it's not easy, right? So you'll have to be very clear of what the result that you want. That is the most important thing when it comes to aesthetic procedures. Be clear in what is your result. Then you understand what are the options available for that result, and then you take whether you're willing to go through the downtime and any minimal risk or any recovery period, whether you're willing to go through that. And then you have to consciously opt for it. These are not mandatory procedures. You don't have to do it tomorrow. You can do, if it requires 2 weeks of recovery period, do it when you have 2 weeks of time. But instead, don't try to do something now that you can't take 2 weeks, so you'll keep looking at what are the options which says quick, okay, you don't have to take leave, you can go to work next day. Just do, you see that advertisement and you go there. You're not going to be disappointed.
Yeah.
It's not going to give the results that you're expecting, right? So that's very, very important.
Well, actually, I feel like, this is something that we would have needed probably another hour for. It's super interesting, and I have loads of other questions, but unfortunately, we're going to have to sort of bring this in.
Yes. Let me, do you have any other questions for all the, viewers here who's actually watching this program? If they have any questions, they can just put in the comments. They can, we are, every second week we host this Insta Live program. Basically, the aim is to create more awareness in aesthetic procedures and not to hesitate asking, discussing regarding procedures, and to be more informed. And they can, keep following our Instagram page and send us those questions. Will help us to frame a question pool so that we can address in every, process. They could have gone to a consultation with some other surgeon. I'm very happy if they have a doubt, they can post, on in these Insta Live sessions, and we will address them during these sessions, and so they can have a clarity about what are the procedures that is being offered to them, whether that is ideal for them or whatever it is.
Super. Well, Dr. Jayanthy, thank you so much for everybody who's been tuning in. We've been talking about the subject, the big subject that is body contouring. So if you guys have more questions, you can get in touch with her on the Tamira Life Insta handle, and she'll be happy to answer. Perhaps curate a session especially for you. Doctor, thank you so much. Any last words from you before we sign off?
No, I'm wishing all our viewers a very, very happy New Year. And I just, I would like to tell each and every viewer or someone who's considering body contouring, look at all the options that's available. Make a list of the end results that you are actually expecting. Discuss, meet a surgeon who's offering you all the options and not limited by certain options. And then you please do consult few other surgeons to make sure the plan given to you is the right one that is meant for you, and then decide to go ahead with the surgery.
And feeling fabulous in 2020. Thank you so
Sure.
much.
Thank you. Bye-bye.